Hello, I'm Diane Posser-Slattery. I'm the President and CEO of MyMichigan Health. Today, we are celebrating an exciting milestone in our service to Bay County with the opening of a brand new emergency department. Our purpose at MyMichigan Health is creating healthy communities together. One important way we do that is to collaborate with our local communities to bring your care as close to home as possible. With the investments we are making in Bay County, we will be able to care for our patients when and where they need it, through every phase of their care. We now offer primary care, advanced specialists, lab, imaging, rehabilitation services, walk-in care, emergency care, and more advanced treatments and services, all within a 20-mile radius. We even have a slate of virtual care options that enable you to get care right from your home. We help people stay healthy, not just with clinical services, but also with outreach efforts like our community garden and our youth sports partnerships. Our Bay City location is an innovation center for MyMichigan Health. It is a place where we are constantly challenging ourselves to make care better, faster, safer, more affordable, and more convenient for our patients. These innovations will then cascade out to the rest of our health system and improve care for everyone.
We are continuously listening to our community and innovating ways to meet their needs. From the time we opened our health park in 2018, our patients and neighbors have shared with us their strong desire for an emergency department on the west side of the river. Utilization data also confirms a growing unmet demand for emergency services in Bay County. This new access point helps us meet that demand. This emergency department has all the features and advanced capabilities of a hospital-based ED, including on-site 24/7 CT scanning, X-ray, and laboratory for faster results. We've designed it with many patient-friendly amenities that you won't find in most hospital EDs. All private rooms, a welcoming home-like environment with lots of natural light and a cozy fireplace, heated wheelchairs, and a heated ambulance entrance to prevent the patient's body temperature from dropping during arrival. Spacious waiting areas that allow us to separate patients with contagious symptoms, and specialized waiting rooms for safely treating infectious diseases. Bay County also has a higher than average number of emergency visits related to behavioral health, which reflects a shortage of access to those services in the community. Therefore, we have designed this facility to integrate behavioral health into emergency care. These are just a few of the many ways that the community needs are shaping our services. Our facility is staffed by nurses, providers, and other experts with more than 200 years of combined service in delivering emergency care. Our emergency nurses are specially trained and certified using Emergency Nurses Association modules, including Trauma Nurse Core course, Pediatric Advanced Life Support, Emergency Nurses Pediatric course, and Advanced Cardiac Life Support. We also use MyMichigan's simulation lab for further hands-on training. Many of our staff have previously worked in other hospital settings, including emergency care, so they are bringing that experience with them to their new roles. This emergency department will create approximately 50 new positions at this facility when it is fully operational. Those who are interested in applying can view our job openings on our website at mymichigan.org/BayCityJobs.
I'm proud to represent the excellent team of providers who will be caring for you at this location. Our board-certified physicians and advanced practice providers specialize in emergency medicine. We have a proven track record of delivering high-quality care and patient satisfaction. Our team understands that the patient's time is valuable, and we are bringing the same process and focus to Bay City that's currently producing excellent outcomes and top quartile patient satisfaction in all of our other emergency departments. In addition to providing the highest quality care, one of the top goals for this emergency department is a seamless collaboration and coordination of care across all settings. This will enable our patients to get their emergency care in a setting where we already have their medical records and can collaborate closely with their primary care providers. In fact, we can even book their follow-up appointment with their primary care provider before they leave our emergency department. And if they don't have a primary care provider, we can accommodate them at the health park next door. One question that some of you may be asking is, what happens if I come to your emergency department and then I need to be admitted to a hospital? Well, you'll probably be surprised to learn that more than 90% of the time, patients do not require hospitalization after an emergency department visit, but they are discharged home. And it is certainly our goal to help you safely return home as quickly as possible and whenever possible. However, in these rare circumstances where patients need more advanced care and services as their next step, we can provide that within our own health system, just 25 minutes away, or we can work with patients to get them admitted to the facility of their choice. For those who are not familiar with our medical center in Midland, I'll share just a few quick facts. It is closer than Saginaw and easier to get to. Near US 10 in a safe residential neighborhood with ample parking and all private rooms. It's also a teaching hospital with the same level of advanced technology you'll find at large academic medical centers. For example, we are certified as a Level 2 trauma center and a primary stroke center with 24-hour access to critical specialists such as trauma surgeons, neurosurgeons, anesthesiologists, and Michigan Medicine's telestroke team. Our award-winning heart and vascular program can perform every advanced treatment that is available at places like the Cleveland Clinic, with the exception of heart transplant, which is done at our partner affiliate, Michigan Medicine in Ann Arbor. And MyMichigan has long been a leader in investing in the latest imaging technologies, image-guided therapies, and minimally invasive procedures. Those advanced care options are now more seamlessly available to our Bay County patients when needed.
Having the emergency department next to the family medicine practice will facilitate coordination and prompt outpatient follow-up with a primary care provider. The emergency team specializes in dealing with life-threatening concerns, but often the patient also has underlying conditions that need to be investigated and managed on a longer-term basis. It's important for patients to have a timely follow-up appointment so that we can identify those issues, refer them for testing or specialty care if needed, and help them manage their health to prevent future emergencies. Emergency patients who do not already have a primary care provider will have the opportunity to establish care with one of the providers at the health park. We offer a wide range of services conveniently located at the health park, including family medicine, orthopedics and sports medicine, obstetrics and gynecology, cardiology, endocrine surgery, nurse care management, ambulatory pharmacy services, rehabilitation services, laboratory, x-ray, and visiting specialists from Michigan Medicine, the healthcare division of the University of Michigan. We also have a new walk-in care facility called Easy Care that is located inside the Meijer just down the road. This provides our patients quick access for minor illnesses when their regular doctor is not available, plus rapid testing and occupational health services. We have a new offering called Virtual Easy Care, where patients can self-schedule a video visit with a MyMichigan Health provider for acute illnesses that don't require an in-person exam. This is especially beneficial during the current pandemic as it provides a safe way for us to triage patients who may have contagious symptoms such as cold, flu, COVID, or other respiratory conditions and direct them to the nearest location for testing and treatment that they need.
So as you can see, we are truly creating healthy communities together with our neighbors and partners in Bay City. And we have you covered for all your healthcare needs. And now, please enjoy a virtual tour of our new emergency department.
We've designed our waiting room to be as comfortable and home-like as possible with lots of natural light, a cozy fireplace, complimentary beverages, and curbside heated wheelchairs. We also have a separate waiting area with external airflow for safer care of patients with COVID-19 or other infectious diseases. Our heated ambulance garage helps keep the patient's body temperature at a consistent level during arrival. This is particularly important for trauma cases. In our triage area, nurses evaluate patients to determine the urgency of their conditions so we can see people in the order of greatest need. This is also where we will draw outpatient labs after hours and on weekends. If a patient has been exposed to a hazardous substance, such as agriculture or industrial chemicals, we have a decontamination room where we can get them safely cleaned up before placing them in an exam room. Our nurse and provider station is designed for observation, efficiency, and communication. Our exam rooms are all private, with windows for natural light plus in-room TVs. We have the latest equipment, including telemedicine carts to involve specialists in your treatment and planning. We also have specialized behavioral health rooms and rooms with external airflow to reduce the spread of infections. Our trauma rooms are more spacious and have more advanced equipment so that our team can easily move about and stabilize patients who are in serious condition. We have on-site, state-of-the-art lab and imaging equipment for faster results. These services are available 24 hours a day, 7 days a week, for both emergencies and routine outpatient testing. There's no extra charge for the convenience of after-hours service for non-emergency testing. And you don't have to be a MyMichigan patient to use our services. We accept physician orders from any location. For laboratory services, you can walk in or book online. X-ray and CT scans require an appointment. Enter through the health park during normal business hours or check in at emergency when the health park entrance is closed. The emergency department is directly connected to the health park, which allows excellent communication and follow-up with our primary care providers and other specialists. If a patient doesn't have a primary care provider, we can quickly get them assigned to one of our providers and even schedule their follow-up visit before they leave the emergency room. At the health park, we are always innovating to find more patient-friendly ways to deliver care. We have replaced the conventional waiting room with a quicker check-in process, heated massage chairs in our exam rooms, and relaxation zones where family and friends can chill out, use technology, or listen to soothing music. The health park has advanced capabilities in sports medicine, including a full-time sports medicine primary care provider, on-site physical therapy, and visiting specialists in orthopedics, pediatric orthopedics, and musculoskeletal oncology.